pick the right healthcare team for you. This is a journey. There will be ups and downs in the journey. It's not going to be smooth sailing. You could have the earliest, easiest disease that you're dealing with. You're still probably going to have surgery. You may need radiation. You may need chemotherapy. Yes, we're going to cure it 90% of the time, but 4 months of chemotherapy is not easy. Surgery is not easy. All of these things. So be wise in selecting the medical team. And the two things that I would advise in terms of selecting the medical team.
Hi, everyone. I'm Samira Daswani, the host of the podcast, The Patient from Hell. I have a very fun and very special guest who I'm going to call Dr. Nabhan. He's going to correct me to Shadi.
I will.
Shadi, what?
Thank you so much. I know when you said fun, I panicked a little bit. I'm like, is this really about me for real?
Yes. But I spent enough time with you to know that a conversation with you is going to be very fun.
Lots of pressure now. I gotta maybe have to figure out how to be fun and funny. No, thank you for the invite. I'm really looking forward to our conversation.
We're going to start with my favorite topic. You ready?
I'm ready.
You're going to start with AI. We have to.
Of course.
And I think you had a 3-word summary that I was very happy about. Hype, hope, and reality.
Yes.
Okay, we're going to start there. Hype, hope, and reality. Let's go.
Well, I think it's like any new technology. There's a lot of sometimes hype about it, right? I mean, it's going to transform the world. It's going to do a lot of things. And sometimes it's not really clear if it is true or not. But oftentimes these new tools, these new shining objects that we see, we gravitate towards because number one, we're curious about what they are, how they work. And number two, we have the imagination that they are really going to make things better. Sometimes these new shiny objects do make things better and sometimes they don't. So there's a lot of hype about AI just because it's a new thing. This transforms into hope that this new thing is going to hopefully help us in every aspect of life. Now, we're obviously focused on healthcare, so clearly we want this to help us in the healthcare sector, and specifically from a patient perspective. Ultimately, what we do in healthcare translates into, is this going to help patients? So there's a lot of hope that this hyped thing is going to really help us take care of patients and help us in patient care or care delivery. And then you get to the reality. Once the dust settles, once you know more about the technology, about the innovation, you get to the real deal of knowing, how am I really taking this and applying it in day-to-day life? And often it is a bit less, it's more nuanced and maybe not as hyped as before. But personally, having now been working with AI for a while, I think AI is real. I think it is here to stay. I think it is going to transform our lives, whether we are dealing regular life or in healthcare. And I certainly have the hope that this eventually is going to translate to our patients doing better, living longer, and with better quality of life.
How do you use AI in your personal life?
I think in my personal life, like all of us, I think we have the usual search engines that we use, whether you are using it's your large language model du jour. Somehow I became really very interested in Perplexity. I do like Perplexity. There are times where I have used AI if I'm trying to simplify a complex subject and I'm trying to think, how do I explain this to patients? I have my own way of explaining things to a patient. But I have to admit, Samira, I became a bit curious. I'm like, well, let me ask AI, how would AI explain it? And part of this, by the way, is because I know patients are doing that. Families are doing that. So I want to know what they're receiving, what they're getting.
Yes.
So let's say I'm talking about CAR T cellular therapy. So how would you, I would ask a search engine, simplify CAR T cellular therapy to a patient I am caring for. And I would read what this comes back to. and I would try to see, well, how would I have explained it? And then I would mesh those together. I think this is important because patients, families, caregivers are actually doing this. So I think it would be naive not to think about this. So I use that. Lastly, I think what I have been using is I've actually what's helping professionally, which is it's a mix between my regular life and professional life. But sometimes I know of a particular stat or a particular topic, and I just cannot remember the citation of that topic. So, for example, I would say, what is the best citation that I could use for to show that less than 10% of adult patients with cancer are enrolled on clinical trials? Now, I know that this stat is correct. I have a couple of ideas of which paper that is, but maybe there's a newer one. So I would ask what's the newest one, which I could go to PubMed and so on. But I find these search engines and the AI are actually very effective in this. They actually come back with all of the information. So these are just some examples how I use that.
I love it. Okay. You've mentioned patients a couple of times, and I'm right there with you. I think patients are absolutely using AI kind of across the board. Can you talk to us a bit about what you're seeing where a patient or family member is using AI and it's helpful, and a different one where you're like, I need to give this patient some cautionary advice based on what I'm hearing from them and their use of AI?
Yeah, I mean, look, AI at the end of the day is leveraging a lot of the inputs, lots of the information that exists out there to provide you with the output that you need.
Yes.
So it's garbage in, garbage out. If their input is not very good, the output is not going to be very good. So I always have to caution people and patients to be careful of what they are getting. And it's almost like trust but verify. What I see a lot of patients doing, and even I've asked some of my people who are not in healthcare, who are friends, they say that sometimes they encounter a lot of complexity in understanding some of the medical reports that they are receiving from their doctor. Think about a genomic report or next generation sequencing.
Yes.
Think about a CAT scan report. Sometimes you get this CAT scan report, 3 pages and so on. So what they do is they try to ask AI to simplify that. They say, like, help me understand what this is because I don't really understand it. And AI does a good job at it. So they do a lot of this. But I continue to caution patients that the power of AI is definitely with having a human in the middle, a human expert in the middle. That really is going to be the key. So it's very powerful. And I think probably the human interference in the middle is going to become less and less with time, actually. That's what I predict because AI learns. Learns with time. So, the AI that we're using today and its power is going to be absolutely different than 5 years from now. So, I just tell them, make sure that what you are getting verified with a professional, with an expert, to make sure that you're not being misled with whatever recommendation you're receiving.
Shadi, so here's maybe a slightly nuanced question. So you've been practicing medicine for a long time. And
yeah, currently I don't have a clinic that I'm seeing patients at. I do a lot of virtual second opinions, but I did for over 20 years.
So given what you've experienced yourself, given the many waves of innovation, because we have had innovation happen in our lifetime several times, what feels to me with AI is the pace of innovation is unprecedented. And pre-post a spike in innovation like the one we're in, I wonder what the world looks like. Give us a sense of like what it was to practice medicine 10, 15 years ago in oncology and what it might look like in 26.
You just told all of your audience that I'm old. I'm an old man.
Oh, I'm sorry, but you are fun.
It's okay. It's okay. I try. I try. No, look, I think honestly, lots of the innovative things that we have, we always think of them as impossible until they are possible. I lived in an era before the internet. So when I had to research a topic, I actually would have to go to the library. And I did. I had to go to the library. I had to talk to a librarian. We had to look at books. We had to look at references. So that I don't have to do that. I can just research anything I want on my laptop anywhere I want. That did not exist. There was a lot of manual things that we had to do just in terms of practicing. But going back to your core question in terms of practicing, I think when you think about all elements of taking care of patients, there was a lot of manual work that we did that right now it became automated. There was time, when I would see patients, the vitals will be written on a clipboard at the bedside, and now they are written in an electronic health record, and you can look at the trends and you could look at this versus plotting your own thing. These are simple things, but they actually are transformative. The ability to communicate with people across, thousands of miles by email. There was no email. I mean, so it just makes things much easier to communicate and so on. But I think when it comes to patient care, the most innovative thing, in my opinion, will always be the therapies that we have and the targets that we have. We cure more patients that we have ever dreamt of. And we are able to care for people more than what we ever thought we could. And all of this is innovation. The type of treatments that we had for breast cancer in 1995 are completely obsolete today in 2026. Women who are affected by breast cancer today are more likely to be completely cured from this disease, where we could not say that 30 years ago. So I think the best thing I will describe, I don't want to digress, I would say put it in two buckets. One bucket is cancer care delivery, how we delivered care. That has changed significantly. And number two is the type of care we delivered, the type of therapies we prescribed, the type of diagnostics that we have are very different. When I first was caring for patients, there was no next generation sequencing. There was no, Oncotype DX if you're talking about breast cancer and so on. All of these came by later. So it was very distressing, because today when you're taking care of a patient with cancer, you walk in and you have options, you have choices. You can tell more patients than we ever thought that yes, you have cancer and I'm sorry and it's awful and it's terrible, but we can cure this. And let me tell you how we can cure this. We are saying more of these phrases and we mean them than we ever thought we would say.
I really love that framing. That's a beautiful way to frame it. So given that framing, you also wrote a book recently, and the book is about roadmaps. So given this innovation, given the two types of categories we have, given choice, and to a large extent, choice that has never happened before for a patient, why do we need roadmaps?
Well, it's pretty confusing out there. Imagine I just dropped you off in the middle of a very, very, very busy airport in the middle of nowhere, and you don't speak the language, and you're just there by yourself. It's confusing. It's overwhelming. You don't know what to do. You don't know who to ask, what to ask, and you don't know how to even communicate, and you could be completely lost. And that could really make you very overwhelmed. Now, this is exactly how healthcare is for people who are not entrenched in healthcare. People are not really working in hospitals all the time. They're just not, this is a very foreign environment to a lot of people. Then think of cancer. It is the most overwhelming thing a person could go through. no matter what, it's life-threatening. Because yes, we cure a lot of it, but we don't cure all of it. So there are people who don't get cured, unfortunately. And when somebody is affected with cancer, it is probably one of the most vulnerable times in their lives, no matter how powerful they are. And I know, Samira, you know this more than a lot of people. It's very overwhelming, psychologically, mentally, physically, everything. So with that, people then have to make decisions that are very, very important. You know, do I do surgery or not? Do I do chemotherapy or not? Do I do radiation or not? I mean, there's so many decisions they have to make. So I think despite despite the wealth of information that we have out there, despite all of the data that we have, despite all of the search engines that we have, when it comes to it, people, when they are affected with their health, and especially cancer, are overwhelmed, they're scared, they're concerned, and they want guidance. And I wanted to provide that guidance to people that don't know me, that I can reach to. And I thought the best way to do that is by writing a book called The Cancer Journey, which is really a simplified book. It's written in a simple language, easy language. I leverage storytelling, lots of the stories of people I have cared for over the years. And my goal was for anybody that reads the book, whether it's a patient, a family, a caregiver, a primary care doctor, a nurse, whoever it is, they have better understanding of what cancer is. They have more appreciation to the journey that patients go through cancer, and hopefully they're able to be a resource to these people. So I think more than ever, we need that guide. We need that guidance because things are very messy out there. Separating signal from noise is very important. And I think we need to help people when they're dealing with this disease.
Shadi, there was something in the book that I appreciate the framing on. So we've spoken about curable disease, but I like the way you have framed advanced or metastatic disease. I think you call it controllable. And I feel as though that framing is more pertinent today than ever before. I can't tell you how often I meet a lung cancer patient, metastatic non-small cell, and there is this perception that a metastatic non-small cell diagnosis is effectively terminal. And in some cases it might be, but today we are sitting in a world because of NGS, because of targeted therapies, that disease is now more controllable than ever before. Can you talk about why you frame it that way? Can you talk about what that framing allows us to do as a clinician? Like, what does that give you in terms of a toolkit?
Yeah, I mean, I covered the staging chapter, and the goal of this is because I was thinking, when you tell a patient you've got stage 1 or 2 or 3 or 4, does this really help the patient? We panic, obviously, the higher the number is, we panic versus the lower the number is. But when it comes to it, what does it mean from a patient perspective when you say stage 2 or 3, except the 3 maybe is worse than 2? And I provide a lot of examples on that. So I think from a patient perspective, what patients want to know is the goal of therapy linked to the stage. So I thought to myself, the best way to do it is I tell a patient, you have a curable stage where we can get rid of the disease completely, or you have a controllable stage where we may not be able to get rid of the disease, but we'll be able to keep it at bay. And the reason that's important today is because we have a lot of new therapies today that are used for cancer in a situation where they may not be able to cure the disease completely, but they actually keep it in check. They kind of keep it in check. So it just stays out there at bay. So the patient is able to do the usual activities. They can go to work. They can do everything. They are living with cancer, but they're still able to have good quality of life, and the cancer is not causing problems. It's akin to having diabetes, akin to having hypertension, akin to having some of these chronic diseases. Of course, with the caveat that the treatment for the cancer, even at a controllable stage, could be a little bit more toxic. So we have to balance the quality of life here and so on. I think today more than ever, this is really important. So if I sit with the parents and say, look, I don't think we can cure the disease, but let me tell you how we can control it, and we can control it for years to come. And that, from a patient perspective, resonates better than giving them the stage number, in my opinion.
I very much agree with that, by the way, which is why I wanted you to talk about it, because I thought you did a really good job of highlighting something that I think is it's one of the most acutely stressful moments of the cancer experience.
Absolutely.
And a slight reframe makes a huge, huge difference to everything that comes after that moment. So I very much appreciate you sharing that.
It's like, I tell a patient, let's say a patient is diabetic that I'm seeing, like, well, you have diabetes, Mr. So-and-so, right? Yes. Do you take medication for it? Yes. Are you able to do everything despite having diabetes? Yes. Well, we're going to try to do the same for the cancer that you have. It could be a pill, it could be an IV therapy, it could be a subcutaneous injection, whatever it is. But we are going to still trying to actually do our best to keep it in check as much as possible. So I think it resonates with people more, in my opinion.
So you've been someone who's seen almost all sides of the cancer ecosystem. You've practiced medicine, you've written books, you've been a part of startups, you've been really deeply immersed in technology and AI. So I have a couple of future-oriented questions for you. And imagine that you could talk to any healthcare system leader. So we're talking care delivery right now. And you could give them any piece of advice for how to navigate 2026. What would you tell them?
So this is someone that leads the healthcare system, kind of. I would say you have to be agile and open-minded to new emerging technologies and the entities and the systems that are more innovative, that they think outside the box. These are the ones that are going to prevail and they're going to do better. A lot of times it's very difficult for large healthcare behemoth or large healthcare system to kind of move from point A to point B. It's just, you kind of get set in your own ways. I mean, you've been doing something like this for the past 20 years. Are you going to change now? And it's been working for you and so on. But I think that's really important. That's number one. Number two, my advice is always involve patients in the decision making. Have a way of getting some ideas of the people that you serve in the decision making. It's not just patient survey that you usually get after you see the doctor, they do okay or not. More of like strategic type of thing. Let's say you are thinking of doing whatever it is. It could be you wanna offer free parking to all patients. You wanna offer hours on Saturday and Sunday. You're changing the triage in the ER. I think ultimately patients and families are the ones who are consuming your product, what you are doing. So let's involve them in decision making. And number three is you should try your hardest to have clinical trials available in your system. Clinical trials for patients and families are critical. They're important. They got us where we got, here. Everything that we actually used in the past was really, something that was not in clinical trials. And now we have that in clinical trials. So I think it's rather important to be open-minded to make sure that we have clinical trials available.
Okay, if you could do the same thing, but now for a pharmaceutical company leader, what would you tell them?
Patients are going to be important as part of the decision making that you do. I think it remains important, and I think that pharma companies have done a better job involving patients in the design of their clinical trials. So I think that is key. So involve patients in some of the design of the clinical trials. Just simple things. Do you need to do 3 biopsies a month of a particular study? Does this really affect enrollment? Is this good for patients, not good for patients? So try to make sure that patients are aware of the initiatives and what you're doing. I think the drug prices are an important part of the conversation. There are a lot of issues happening there. There are a lot of policy changes in the US and outside the US. So this will always continue to be a problem for people who are not able to afford some of the pricing of these new drugs. Having said that, I think there's always this happy medium. So there has been some initiatives, as you know, here to negotiate drug prices. We don't know how well this is going to be versus not. It's too premature to actually tell the impact on that. But I think maybe have more thoughtful way of addressing drug prices in continued discussion with all stakeholders involved. So these are the two things. And lastly, also, you have to get innovation as well. I mean, as a pharma company, it's going to take you 10 to 15 years to get a drug to market. Start thinking of innovation. Start thinking of AI. How can AI help me accelerate drug development? Because sometimes the difference between life and death is the availability of a drug that was going to make a difference for a patient's life. And that is why I think companies that are engaging with innovation, with such as AI, may be able to accelerate drug development to get drugs faster to market.
Okay, so here's my last future-oriented question for you. If you could give advice to any of your virtual second opinion patients whom you may not be seeing physically in front of you, right? So you're sending this presumably asynchronously. What advice do you give them?
I think it's important to, first of all, I recognize how difficult it is to be diagnosed with any type of ailment, not to mention cancer. I personally, the advice that I would give is not related to medication or drugs and so on. It's actually more pick the right healthcare team for you. I really think this is important. This is a journey. It's not a one and done. It's not just you going in to see the doctor for, it's a journey. There will be ups and downs in the journey. There will be ups and downs in the journey. It's not going to be smooth sailing no matter what. You could have the earliest, easiest disease that you're dealing with. You're still probably going to have surgery. You may need radiation. You may need chemotherapy. Yes, we're going to cure it 90% of the time, but 4 months of chemotherapy is not easy. Surgery is not easy. All of these things. So there will be ups and downs. So be wise in selecting the medical team. And the two things that I would advise in terms of selecting the medical team, and I actually wrote that also in the book because I feel strongly about that. Of course, the expertise, right? You have to make sure that the medical team is able to care for the condition that you have. But availability is key. Availability is key. Are they going to really pick up the phone and talk to you when you need them? Are they available? How accessible they are? When you are not feeling well, who do you call? And if you call, do they answer? This is so important because that's really what you need. You need someone available during the journey. And I think that's really critical. And lastly, get second opinions. Like you get first second opinion, get other third opinions. It's totally fine. I mean, you go to whatever, when you buy something that is not really that critical, sometimes you get opinions of your friends. Well, this is your health. So getting other opinions always matters, in my opinion.
Right. Shadi, what are you personally, last question, and this is our wrap up. What are you personally most excited about for 26?
AI. I really am. Even I wrote a book on AI now. It's coming on later on in 2026 on AI in cancer care. I was a skeptic a couple of years ago. Several years back, I was skeptic. Now, I mean, it's just really going to make a huge difference. So I wrote a book on AI in cancer care. It's coming up in the fall of 2026. And it's really helping patients, families, providers understand how AI affecting cancer care, also written in simple language. So I think this is the most I'm excited about. And I'm hoping that this eventually translates more drugs and more patients living and more of our ability to combat cancer.
Thank you so much for being a guest on the show. I really appreciate you. I
It's
hope
my
this
pleasure,
year is everything you hope it to be.
Congrats on everything you're doing, and I wish you all the best. Thank you so much, Samira.
Thank you, Shadi.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Mantacares Inc. or Mantacares' sponsors.